Hi, my name is Lauren Price, and I will be discussing the social determinants of health with a transgender patient. So get to know my patient. My patient, her name is Monique. She's a 27-year-old transgender female. The survey of social determinants of health is below. For nutrition, she is severely short of food. Her daily activities, which include physical ability and strength, she is able to easily perform all daily activities. Her housing, she has subsidized housing or significant housing issues. Education, she holds a bachelor's degree or license. Employment, she has a job but is a difficult work environment. Healthcare, she has access to care but chooses to avoid wherever possible. Incomes allows for inconsistency meeting basic needs. Transportation, she frequently has difficulty getting transportation. Technology proficiency / access, she has no internet access. Legal, she does have some legal issues. So system processes and structures in healthcare that perpetuate discrimination within healthcare include transphobia, lack of training, financial barriers to accessing care, and policy and legal barriers. According to the Merriam-Webster Dictionary, transphobia is discrimination against, aversion to, or fear of transgender people. Signs of transphobia is discrimination and mistreatment of those who are transgender. Healthcare workers may have a lack of training when it comes to caring for those who are transgender. This can include improper communication and pronoun preferences, and they may be unaware of sensitivities when it comes to the patient. Financial barriers may come from the inability for the patient to have gender reassignment surgery and may lead it to be difficult for the healthcare provider to identify the patient correctly. Policy and legal barriers include the lack of legal protection for transgender patients. There are some general social determinants of health screenings, and then there are some that are geared towards the LGBTQ population. Some general screenings include the accountable health community's health-related social needs and the PREPARE, or the protocol for responding to and assessing patients' assets, risks, and experiences. A few LGBTQ geared screenings include the Needs Assessment Survey and the LGBTQIA+ Patients and Social Determinants of Health Screening and Documentation webinar. The Accountable Health Community Screening Tool includes questions about housing, transportation, food insecurity, and financial stress and strain. The PREPARE focuses on income, education, housing, and social support. The Needs Assessment Survey is a 35-question survey that focuses on demographics, gender identity, access to healthcare, and mental health. The LGBTQIA+ Patients and Social Determinants of Health Screening and Documentation webinar focuses on disparities for the LGBTQIA+ people. Assessment. When assessing a patient who is transgender, it is important that you always start by asking the patient what pronouns they go by, whether it is he, she, or they. When assessing the patient by relevant anatomy that is present, it is important to make sure no assumption to the identity of the patient is made based on what they look like on the outside. This is where asking what their pronouns comes into play and is so important. It is important to use gender affirmation, meaning recognizing, respecting, and supporting their gender identity. Available resources. There are multiple available resources that Monique can use based on her survey of social determinants of health. When it comes to her food insecurity, there is SNAP or Supplemental Nutrition Assistant programs that will allow Monique to receive monthly benefits to purchase food at grocery stores, corner stores, farmers markets, and other participating food realtors. When it comes to housing, a program that I found in my area is the Transgender Assistance Program for Virginia. This is an all-volunteer program that assists to end homelessness in the transgender community in Virginia. They offer safe emergency housing to homeless transgender adults to help them find additional resources they need to remove the barriers to self-sufficiency. When it comes to her unsafe work environment and her income insecurity, a good resource for safe employment and secure income is the Trans Work Jobs Program. This program connects transgender applicants with supportive businesses in a range of industries and for a diverse set of skill levels. A resource that can help with the transportation is Out Youth. They provide free 31-day bus passes to ensure there is a reliable transportation to school, work, appointments, and wherever else life may bring them. A resource to help Monique with her legal trouble is the Transgender Legal Defense and Education Fund. They work at all levels to ensure trans voices are heard and embraced in rooms that have been ignored. And these are my resources.